Good afternoon, my friends. Welcome. My name is Jackie King. I am the owner of Yana Healing and Balance. I'm a licensed massage therapist, an energy healer, Reiki master, and certified infant massage instructor. I'm here with Dr. Andrew Doro, very gifted and talented chiropractor working at Little Flowers. His specialty is working with pregnant moms, families, and very gifted with, and I can probably say that his passion is with working with infants. So, Dr. Doro, is there any research on the topic of a newborn's ability to feel cranial and or spinal pain? And how is it possible that they can feel pain at such an early age?
Sure. Come to my disbelief, when I looked at the research, and I started studying this research about 10 years ago on the concept of babies feeling pain, and a lot of times when our babies are experiencing a colic-like symptom, we are assuming they're in some kind of pain. Because when you think of a colic, you think of a screaming, crying, or spirited, fussy baby. But more specifically, when we think about this from a standpoint from the baby, why is a baby so upset or fussy? We like to assume that babies feel pain. About 15 to 20 years ago, the medical community in neonatology had implied that babies do not feel pain up until a later certain age. And with the new advent of functional MRI, which basically is an MRI is a way of measuring brain activity and a functional capacity. So Oxford University did a recent study on infants and neonates with comparison of a noxious or painful stimulus compared to an adult with the same stimulus. And in this study, they had infants between 4 days and 12 days old, or neonates between 4 days and 12 days old, and they took a brain MRI and compared the brain MRI between adults and neonates. And the results were pretty impressive. And it confirmed my suspicious belief that babies are feeling spinal pain from various forms of stressful and difficult labor and delivery. But to get back on track, what they found is there are 21 centers in the brain that are in charge of feeling pain or perceiving pain. And in this study, they found that infants, whether they had a pinprick on the bottom of their foot or a feather brushed against their foot, it lit up 18 centers in the brain compared to adults. And what they found was the adult was able to modulate or deal with certain stimulus, where the baby wasn't able to. In fact, they were quite dramatic. And I think that we can agree that our little blessings tend to be a little bit dramatic, and that's okay. But what it is, just because a baby is crying incessantly for 3 or more hours a day, which is the definition of colic, is not just an okay, dismissive scenario. Babies are crying for a reason. They are also humans. We don't think of it because we can't talk to them. And the problem is we have trouble understanding colic. We have trouble understanding a baby who's crying and screaming because there's a language barrier. And our job as hands-on technicians or massage therapists or chiropractors is to be the spokesperson for their physical body. And what I have found in clinical practice is when a baby is presenting, I have a little baby model right here, presenting with a head tilt, or that won't change, or they have a body curve, or they're too tucked this way, or too extended this way, screaming and crying, it could imply the baby is having spinal pain. And what we've found is the little tiny nerve receptors in the spinal joints, and by the way, Jackie, these are the bumps you feel when you feel someone's back, and I know you know this, but our viewers might not. So to orient yourself, this is the back of the head, back of the spine. But these joints right here, these are called Z joints, zygoapophyseal joints, and they're loaded with pain joint receptors. And when they get swollen or strained or sprained, which is what I feel for, what I'm trained in, delivering specific care to these injured spinal joints to an infant, I have found that when I give care to this spinal joint that's swollen, and over time the swelling decreases, what do we find? The baby's happier, calmer, sleeps better, and all of a sudden the colic symptoms go away. Now it begs the question, what am I giving care to? Well, apparently I'm giving care to what I would call a cervical strain and sprain injury. And that's why these touch therapies are so effective and safe when done correctly on the infant who has a body pain syndrome. So my research over the years, there's a mounting or a more of an abundance in opinion and research on the fact that babies do feel pain. We don't know quite sure to what degree, because we can't ask a baby on a scale. Little one, is it 0 being no pain or 10 being in the hospital? Where are you on that spectrum? Let's just assume they're all very dramatic and in a lot of pain. For colic symptoms, if they're exhibiting colic symptoms, we have to understand that it could be from body pain, spinal pain, or headaches, for example. Obviously, there are lots of causes of colic. It could be digestive issues. It could be just an emotional release of too much stimulus or not enough stimulus at the end of the day. It could be an immature gut, gas. If a baby's breastfeeding or bottle feeding, it could be an intolerance to a specific diet that the mom has, or a specific intolerance to a various formula. So without having boiled the ocean too much on colic, a large percent of infants who have these colic symptoms are apparently experiencing some kind of spinal pain or cranial pain.
That's very interesting.
Mm-hmm.
And I'm glad that research is there.
When I was doing my doctorate, what they call the final research or dissertation, mine was on the colic symptom of the infant and how we really don't know what the cause is. And pediatricians will agree. In fact, most of their responses are, oh, it's no problem, it's normal, they'll grow out of it. And that's fine, but we have to understand that parents are also suffering from this poor little blessings that are screaming and crying. Family wellness is at stake here. It's not just something to be dismissed. Common doesn't mean it's normal. So I guess on that sense, Jackie, do you think that babies would benefit from a gentle touch therapy such as chiropractic care or massage therapy in order to relieve their pain for such symptoms such as colic? Can you elaborate on that in your experience?
Absolutely. I think that all babies and all people will benefit from chiropractic care and the touch therapy of massage. There's so much research that has been done on massage for infants, done by Dr. Tiffany Fields at the Touch Research Institute in Florida. Her research primarily was done on premature infants and how massage that has been provided to infants on a daily basis, infants gained 47% more weight daily. They showed better attention, slept better, and they were able to leave the hospital 6 days sooner, which relates to saving thousands and thousands and thousands of dollars. But to pinpoint it a little bit more, though, massage therapy is beneficial for both parents and infants in that it creates that stronger bond between the parent and the child. It gives parents a better sense of how they can better respond to the infant cues that their baby is giving them. And for baby specifically, it can help them digest and eliminate easier, because a lot of times, as you had said, depending on mom's diet, if she's breastfeeding, sometimes there are some issues with that. Baby gets a little bit gassy, can't eliminate easy. And there's pieces of the baby massage program that can be pulled out specifically to help the child eliminate much easier. It stimulates circulation, both blood and lymphatic fluid, which of course helps with a strong immune system and decreases illness. Mm-hmm. Strengthens all of the body systems, and for the child, it helps them mature faster on social, motor, and neurological levels. Can help decrease the pain of teething. And for parents specifically, it gives them that chance to relax a little bit too and spend that quality time with their baby, because this is something that should be done with a child, not to a child. So there's many benefits for baby and parent to when massage is put into the equation. But yes, just being able to relax and take that stress component out of there, because we know that stress irritates so many things in our life and can exacerbate pain. So when we can help baby relax, calm down, sleep better, reduce the pain, it makes for a happier household.
Listening to you, you said it very well. It sounds like more and more parents are trying to do things for their child, their baby, that is drug-free or surgery-free. They're trying to not do things to their baby, but for their baby or with their baby by giving chiropractic care, massage therapy. Obviously, a lot of these therapies go hand in hand. I always recommend the baby has body tension. It's good to do things with them. It puts power in the parent's hands.
Absolutely.
Reliant on going to a medical office and do this hunting for a solution and this treating symptoms rather than maybe causes.
Absolutely.
So I think that it sounds like, and correct me if I'm wrong, it sounds like massage therapy and chiropractic specific therapies are going to really get to the core cause of the physical, chemical, or emotional stress that this baby's feeling. And I think we could all agree that most humans feel 1, 2, or 3, or sometimes all of them at once, depending on your experiences of life, experiences of labor and delivery. Then I think that seeking out a chiropractic physician, a licensed massage therapist that's been trained in infant care is a really good, effective, cost-effective, and safe way to restore normal function and wellness to your little blessing. Is that a fair statement to make, Jackie?
I think that sums it up beautifully.
Well, I truly appreciate your time. I know you're very busy and getting face-to-face is hard, so we did it virtually.
Thank you. I appreciate your time as well and your expertise. And good luck to all those parents that are out there listening.
Parents, if you guys have any questions, please PM us. If you want any more research or anything else to help you make a better decision, please feel free to reach out to us. And we hope to see you guys again soon.